Welcome everyone. So now we will be looking at glomerular diseases. Glomerular diseases include two types of disease. One is nephrotic syndrome and another is nephritic syndrome. So nephrotic syndrome has proteinuria greater than 3.5 milligram per deciliter. So proteinuria is greater than 3.5. That is nephrotic syndrome. And in nephritic syndrome, proteinuria is less than 3.5. So that is nephritic syndrome. In nephrotic syndrome, there is proteinuria which is more than 3.5, and that leads to when protein is excreted out of the urine, then there becomes hypoalbuminemia, means decreased albumin level in the blood, and hyperlipidemia, increased lipid level, hypogammaglobulinemia, and hypercoagulable state. That is nephrotic syndrome, in which proteinuria is more than 3.5. And another is nephritic syndrome, in which proteinuria is less than 3.5, but there is another problem, which is RBCs or loss from blood, that results into hematuria, and that results into edema and hypertension, along with oliguria and azotemia in the blood. So mnemonic for both of these types of the nephrotic syndrome and nephritic syndrome is, for nephrotic syndrome there is made FM. We will also look at this. And for nephritic syndrome there is MAIRA, Myra. This word will be the types of nephritic syndrome. So we will look at the mnemonic for nephrotic and nephritic syndrome. So first of all, looking at nephrotic syndrome, we will look at MAID FM. That is, M stands for membranous nephropathy, A stands for amyloidosis, D stands for diabetic glomerulonephritis, F stands for focal segmental sclerosis, and last M stands for membranoproliferative diseases. And now for nephritic syndrome, mnemonic is Myra. M stands for membranoproliferative, A stands for IgA. Alport syndrome, I stands for IgA, I stands for IgA nephropathy, R stands for rapid progressive glomerulonephritis, in which NCA proteins are positive, and the last A is Alport syndrome. So, in this way, we are going to make a mnemonic for both of these nephrotic and nephritic syndrome. So, in next video, we will look at in depth for both of mnemonics and types of nephrotic and nephritic syndrome as well.